Community and Mental Health Nursing, George Brown College, Assignment 2. Team 2, Gina Tadros, Komal Kaur, Lynn Cabellon, Martin Rebosura Jr., Oluranti Egwim, Tenzin Youlo, Wenlei Jiang. Case: Moss Park, 26-year-old male struggling with IV addiction and homelessness. Definitions: vulnerable populations, specific groups that are at higher risk for poor health because of individual or socio-environmental factors. Poverty, having insufficient financial resources to meet basic living expenses, food, shelter, clothing, transportation, and medical expenses. Harm reduction is a strategy used widely in health policy to reduce harm to an individual or society by modifying hazardous behaviors that are difficult and, in some cases, impossible to prevent. Resiliency refers to the capacity of people to cope effectively when faced with considerable adversity or risk. Moss Park neighborhood. There's exclusively rented out houses. Many low-income families, has a reputation of being notoriously downtrodden, dangerous, center for the homeless and sickness shelters. Clients' social determinants of health at risk: poverty, low income, low social status, unemployed, lack of education and literacy, lack of social support, lack of coping skill, lack of housing, poor health behavior, lack of access to health service, lack of positive culture. Clients' barriers to health services: lack of information about available healthcare services, mental health issues, communication issues, discrimination issues, lack of valid identification, lack of transportation, too many likewise clients on same waiting list. Challenges for community health nurses in dealing with our client: building trust, developing therapeutic relationship, effective communication, behavior management. Client may be aggressive, rude, angry, or having psychotic episodes. Overall plan of action: Moss Park shelters and social services readily are available to our client, and this is due to the rampant drug use and reputation that Moss Park has. Moss Park's community exists a variety of accessible social services, support programs, and healthcare services provided by the government. Overall plan of care: refer our client to a social worker in the community, refer our client to a rehabilitation program, refer our client to a social support group therapy. Social worker in the community, work with clients who have mental health conditions and addictions. Social workers can help the client by providing counseling and helping them find additional resources and services. Refer to the client to a rehabilitation program. Moss Park has rehabilitation services that will help these people struggling with substance abuse. The Salvation Army provides rehabilitation services to the community in Moss Park, referring clients to social and supportive group therapy sessions. A strong mention of overdose rates in Toronto is continuing to increase. Overdose prevention and programs promote health and increase access to health and social services. In particular, the South Riverdale Community Health Center provides supportive group therapy that will support people struggling with substance abuse. Referring our client to a health center for better evaluation, to social service, shelter support, life skill classes, budgeting for cooking, and tight budget and anger management. Also, referring the client to a health clinic for a better evaluation of these conditions. Moss Park has several of those, in particular the South Riverdale Community Health Center, which provides drop-in nurse practitioner services and a health bus program to serve individuals experiencing homelessness and underhousing. Referring the client to social service that provides shelter support. The Salvation Army provides shelter for people experiencing homelessness and support for those needing housing. Referring the client to life skills classes such as budgeting, cooking on a tight budget, and anger management. These educational sessions will help learn and practice daily skills necessary for the sobriety and overall wellness of an individual. The Salvation Army provides life skills classes to help the community in Moss Park. Building a trusting relationship with our client. There is a need to consider a person-first point of view, which is a reminder that substance use may be seen as a coping response to a situation. Identifying the underlying roots of IV addiction will help in developing a trusting relationship with the client and plan actions that are realistic, non-judgmental, holistic, and positive. Assisting client with resources and useful information in order to increase their awareness of and access to drug-free activities, such as educational opportunities, job training, exercise groups. Standards of practice building relationships. Trusting relationship with this 26-year-old male struggling with IV addiction and homeless will be based on the principle of connecting and caring. Connecting involves establishing and nurturing relationships and a supportive environment that promotes the maximum participation and self-determination of this client. Caring involves developing empowering relationships that preserve, protect, and enhance human dignity. Step 1, creating a trusting environment. Environment of trust is essential as the client may have previously been disappointed in their interactions with healthcare and social system and sometimes the law. Do what you say you are going to do. Avoid promising client what you cannot achieve. If you do not know the answer to a question, the best reply is that you don't have the answer, but you will do your very best to get it. Step 2, show respect, compassion, and concern. Vulnerable persons like our client have been defeated again and again by life circumstances. It is important to listen carefully, since listening is a form of respect as well as a way to gather information to plan care. Do not make assumptions. In building a trusting relationship, this client must be seen as a unique individual and must be assessed accordingly. No two people or groups are alike. Providing support to our client will enhance his coping skills, provide a greater sense of personal autonomy and trusting relationship, assist client to gain access to needed healthcare and services, place emphasis on client's strengths and assets rather than client's deficits and susceptibilities to increase his resiliency. Legislation and subsidies available for our client. Health Canada offers funding through Canadian Drugs and Substances Strategy to help Canadians, like our client. Health Canada's Substance Use and Addictions Program provides grants and funding to many levels of government, community, and non-profit organization to respond to clients with drug and substance abuse. Legislation and subsidies available for our client. Part 2, funding is used in substance use prevention, harm reduction, and treatment initiatives across Canada at the community, regional, and national level. Public Health Agency of Canada funds community-based initiatives to prevent and control infectious disease resulting from shared drug use and drug paraphernalia. Nursing considerations. Engage client. Build therapeutic relationships. Provide client-centric care to meet the needs of the client. Identify risks for mental health problems. Screen routinely for co-occurring mental disorders and prevent drug overdose complications. Provide cultural competency care. Nursing considerations. Distribution of naloxone kits to prevent complications of drug overdose. Establish therapeutic communication skills to maintain safety of the client. Provide education regarding signs and symptoms of drug overdose and how to prevent drug overdose complications. Educate the use of clean syringes and proper disposal of used syringes. Approaches in treating drug addiction, behavioral counseling, medication, manage withdrawal symptoms, evaluation and treatment for co-occurring mental health issues, example, depression and anxiety, long-term follow-up to prevent relapse, skills training of medication delivery. Moss Park resources useful for our client. South Riverdale Community Center, primary healthcare, social outreach, community outreach. South Riverdale Community Health Center is a nonprofit multi-service organization that provides primary healthcare, social, and community outreach services with an emphasis on health promotion and disease prevention, primarily to people of East Toronto. Their mission is to improve the lives of people that face barriers to physical, mental, spiritual, and social well-being. They provide services to all the diverse people in our community, reflecting different ages, income levels, ethnicity, identity, health insurance, and housing status. They serve vulnerable communities such as new immigrants to Canada, visible minorities or people of color, Ontario residents who don't have OHIP insurance, people who are using drugs, people with low income, queer and trans folks, young people, children, families, parents, seniors, and people who are homeless or underhoused. Moss Park resources are useful for our clients. Moss Park Interprofessional Primary Care Team, Street Health Services, nursing, community mental health, harm reduction, identification, front desk services, mobile health bus for Moss Park, overdose prevention site, and safer supply. Moss Park resources for our client also include Hospital Emergency Department for Mental Health and Addiction, Center for Addiction and Mental Health, St. Michael's Hospital, Michael Garron Hospital, Sunnybrook Health Science Center, Mount Sinai Hospital, St. Joseph's Health Center, North York General Hospital, University Health Network General Site, University Health Network Western Site, Toronto East General Hospital. Moss Park resources for our client include Salvation Army Harbour Light Center, St. Joseph's Health Center Withdrawal Management Services Toronto, Toronto East Health Network, Street Haven at the Crossroads, St. Michael's Withdrawal Management Services, Breakaway Addiction Services, St. Michael's Homes, Jean Tweed Treatment Center, Center for Addiction and Mental Health, CAMH, substance abuse programs including MAARS, Renaissance Centers, University Health Network, Toronto Western Hospital, Mental Health and Addictions, Reconnect Community Health Services, Humber River Hospital, Corner, a community drop-in center. Moss Park resources for our client include Shelter for Homelessness, Robertson House, they have 90 beds, Sojourn House, 149 beds, Dixon Hall Schoolhouse, 44 beds, Salvation Army Gateway, 120 beds, Salvation Army Maxwell Meagan, 345 beds, Seton House, 562 beds. Moss Park resources for our client, Community Health Center, Anishinaabe Health Toronto Queen Site, Anishinaabe Health Toronto Gerrard Site, Family Health Team Sherbourne Health Center, Long-Term Care, the Riquet Center at Sherbourne Place, Community Support Service Dixon Hall, the Neighborhood Group, Toronto People with AIDS Foundation. On this page, you see our many different references. Mideast Toronto Local Collaborative Priority Addiction Education and Prevention, Addiction Treatments and Information, Neighboring Wellbeing Survey Report. Some of our references come from our textbook, Community Health Nursing in Canada, South Riverdale Community Health Centre, Mobile Health Bus, the Salvation Army, Government of Canada, National Centre of Biotechnology Information, Substance Abuse Treatment for Persons with Co-occurring Disorders, Registered Nurse Association of Ontario, Clinical Best Practice Guidelines, National Institute on Drug Abuse, Treatment Approaches for Drug Addiction. Thank you so much for taking the time to listen to our presentation. We do appreciate it, and have a wonderful day.